Today's groundbreaking is more than just the start of a building or the turning of soil. It's the turning of a page in our college's history and in the story of Central Ohio's future. When complete, OhioHealth Hall will be more than just bricks, steel, and glass. It will be a place where students learn, grow, develop, and prepare for their future in healthcare.
My journey with Columbus State officially began as a freshman in high school through the College Credit Plus program. Through CCP, I was able to complete all my core classes and prerequisites prior to graduating high school. By the time I received my high school diploma, I also held my sterile processing certificate and was ready to immediately step into the next phase of my career, surgical technology. This new building represents more than just classrooms and labs. It represents future students like me, students who are ready to step into critical roles and make a real difference in the lives of patients and families. It will allow Columbus State to double the number of graduates, opening doors for so many more students who are ready to answer the call to serve in healthcare.
OhioHealth Hall will provide a leading-edge learning environment for students, emphasizing simulation and advanced medical technology. We want to replicate the environment students experience when they walk into the job the first day. I want to thank Dr. Steve Markovich, CEO of OhioHealth. Thanks to Franklin County residents, we had the capital resources that would allow us to build a state-of-the-art facility, but we didn't have sufficient operating capacity to hire faculty and staff for the kind of growth that our region needed. Steve and OhioHealth stepped forward with a $25 million endowment, which will allow us to fund healthcare faculty and staff in perpetuity.
It's about people coming together to solve the community's problems. David, you and I did that, and others have been talking about it, and I hope there's some momentum to keep that going. We continue to struggle with a gap in healthcare, and I'm proud to see Columbus State as somebody that came forward with solutions. Our communities are going to continue to grow. We are going to continue to need more and more healthcare workers, and we need to really at least double that pipeline over the next 10 years. And who better to do it than Columbus State?
When I started, Dr. Harrison came to me and he said, hey, I'd really like to be more part of downtown. We're kind of where we are. We have a lot of surface lots. We really felt that if you were going to be working at OhioHealth or Columbus State, you needed places to live. You need places for teachers, for firefighters, for nurses, for all kinds of folks to live. And so we've really tried to do all of that together to make downtown everybody's neighborhood.
We're all rising to this occasion, and I just want to say, this is so important. If we can give a student the opportunity to have a job that pays twice the wage of a median income across the state of Ohio, that's the potential in healthcare. That's just transformative.
Not only did I receive an outstanding education here at Columbus State that adequately prepared me to be a nurse, but both of my nursing roles have been on units where I completed my Columbus State clinicals, which is an incredible full circle experience for me. It's especially meaningful to think about as my own daughter, who is now a sophomore in high school, is already considered nursing. She could graduate with her ADN and her BSN completely debt-free while gaining hands-on experience, working in the field, and also earning an income along the way.
We know that a community college, the data have proven out time and time again, it's one of the best investments you can make in equity and opportunity and reducing barriers to make real careers more accessible to every child, no matter what zip code they are born into. That's what this investment is about.